Hey, good afternoon, everyone. I want to welcome you to the All of Us Researcher Academy HBCU Road Tour, coming live to you from, and I've always wanted to say this, from the beautiful campus of Howard University in our nation's capital, Washington, D.C. We're so excited about you joining us in person and online for our inaugural kickoff of our championship project. And wanted to just contextualize this in regards to I had a moment to actually walk around the beautiful campus here at Howard University and was just really thinking about the scholars that have walked this trail and this path here at Howard University. Founded in 1867, Howard University is a seminal institution in the scholarship in our communities. The institutions here, in particular around law and medicine and social work, have really served to be a trailblazer in fighting for the cause of equity and justice in our nation. And again, it's exciting to welcome you to Howard University and to our first session. I'm deeply grateful for our colleagues here at Howard University for their willingness to sponsor our initial site visit here and to launch the road tour. This road tour will take us into the Deep South to Tuskegee on the campus of Tuskegee University, also into North Carolina at one of the HBCUs there, and perhaps back here at Howard University to celebrate our first cohort of HBCU champions. In terms of why I'm also thankful and grateful, I also want to acknowledge that I'm a graduate of an historically black college and university, Livingstone College in Salisbury, North Carolina. And many of the individuals on the CCPH team, Community Campus Partnerships for Health, are also graduates of historically black colleges and universities. I want to highlight other points in terms of why this work is so important. First of all, I want to acknowledge the fact that I believe that we need to honor and lift up and recognize the scholarship that is really coming out of HBCUs and similar institutions across this nation. It's important that we acknowledge that and recognize it and actually celebrate the scholarship. The second reason is that we need to increase that scholarship and we need to bring recognition to it. And maybe finally, the fact that we are at Howard University and other campuses that are part of this project are in such close proximity to communities that are experiencing the disproportionate impact of disease. We need not think any further than where we are now at this moment of our journey through the COVID-19 pandemic. I wanted to just share these figures with you. Globally, over 6.7 million individuals around the world have lost their lives to COVID-19. Here in the U.S. alone, 1.1 million individuals have died as a result of COVID-19. And it's the work that we hope to launch here to increase an understanding of research and to engage communities, not just academic communities, but also people who are living and experiencing the disproportionality of sickness and disease burden, to have them engaged in research. And it's for that reason, again, I want to welcome you to our afternoon of conversation. We're excited to be here, and we're excited to have those who have joined us in person. At this time, I didn't introduce myself. I am Al Richmond, Executive Director of Community Campus Partnerships for Health. Welcome again, and we are excited to be in partnership with the Research Triangle Institute, RTI, in this endeavor. At this time, I want to introduce Dr. Fatima Jackson, who is Professor of Biology and the Principal Investigator of the Howard University All of Us Research Team. Dr. Jackson, welcome. We're glad to have you.
Thank you very much, Mr. Richmond, and welcome to Howard University. We are very happy to have you here, and of course we welcome you. When you mentioned Livingstone, I remembered that when I was in North Carolina, I would drive by Salisbury all the time. And so I'm sure our paths have crossed, and very grateful that once again we see you here at Howard. As you mentioned, Howard is one of the older historically black colleges and universities. And for us, research has been a central theme because in Howard's founding, there was a recognition that we needed research that would lift us up as a people. And the All of Us project is a prime opportunity to expand the database on African Americans in particular and peoples of color in general, because peoples of African descent have not been adequately recognized and represented in the genomics databases. And genomics is a foundation upon which we build all of the more illustrious forms of research: precision medicine, epigenetics, genotype-phenotype interactions, and so forth. So without that genetic database, we're really at a loss, and our people will suffer. So we really salute NIH and RTI and all of the partners that have been involved in bringing resources to HBCUs for the purposes of accentuating the scholarship, increasing our abilities to work with students and train the next generation of researchers. And I'm very grateful that research is being tied to communities of color, because it's out of those communities that the next generation of intelligentsia in our communities will emerge. So this is a very, very hopeful sign. I wanted to go to my slide if we can show the research that we are doing here at Howard University. It's an honor to be a member of the first cohort of scholars working on the All of Us database. And on behalf of Howard University, of course, I want to welcome all of the other HBCUs that are participating in this endeavor. At Howard University, we are looking at several projects that we hope to do. We are looking at mitochondrial DNA because the record of maternal lineages is understudied in the literature, especially African-centered maternal lineages, and yet because of our history in the Americas, those maternal lineages show the greatest fidelity in terms of genomics and genetics, even more so than the paternal lineages. So we are interested in developing a data-centered evaluation of African-American mitochondrial DNA, and we're currently doing a smaller project along these lines with the Eli Jackson database out of South Carolina and Massachusetts. But we want to expand that to the All of Us database and consider these haplotypes in the light of our fairly extensive African mitochondrial DNA database. So the All of Us database will give us many thousands more African Americans to evaluate. And we're already beginning to see some quite interesting finds that defy our initial assumptions about our maternal lineages. We're also interested in APOL risk alleles in African Americans with chronic kidney disease. Now, apolipoprotein 1 is a genetic trait, and there are two risk alleles, one very common in Eastern and Southern Africa, another common in Western and Central Africa. And what we think has happened is that the efforts of the transatlantic trade in enslaved Africans put together people from different parts of the continent and produce the complex heterozygote, which increases the risk for chronic kidney disease. And this may account for the high frequency of chronic kidney disease and the health disparity that we're seeing in peoples of African descent. So this is kind of a model for other new combinations of genes that we expect to uncover in the All of Us database as we look at a broad cross-section of African American peoples. again, I want to reiterate there's a third project that we're looking at, and then I'll reiterate the importance of the All of Us database. We're also interested in looking at the impact of mitochondrial DNA status and cardiovascular disease. That's a part of a larger study looking at the clinical and evolutionary consequences of mitochondrial DNA status. And the literature, the scientific literature, is beginning to pour in on that. We want to explore it some more with the All of Us database. And so it's an excellent resource. I mean, this is a good use of American taxpayer money, if I may say so. This is my team. Mr. Nicholas Guthrie is here. Oh, so this is there's an updated slide, and I'm sorry we're missing some of the people that I had sent. But Miss Raven Flowers is here, Dr. Vic Mahes, Miss Caitlin Keaton, Miss Dr. Shion King, Miss Maram Mohammed, who has a class right now, but hopefully is calling in, Dr. Carter Clinton, who may be online, Dr. Jennifer Caldwell, who's online, Dr. Hassan Jackson, who may be online, Miss Simone Woodard, who is one of our top undergraduate students, and Miss Naima Bateson, who just recently graduated and is hopefully headed for medical school. And we also have Mr. Obina Asiblemi and Miss Jade Telesford. These diagrams here just show two of the pictures from the research that we hope to do, looking at the phylogeny of mitochondrial DNA in African American maternal lineages, and we'll be comparing that with the phylogeny of African mitochondrial DNA. And then we have a diagram here that shows the complex heterozygote, which is the G1, G2 that I mentioned, coming out of different parts of Africa, combining in the Americas, producing a complex phenotype that increases the propensity for chronic kidney disease. And these are risk alleles that developed in response to trypanosomiasis, which is African sleeping sickness. So this reminds us that no gene is either good or bad. It depends on the context that it's found in, which is why the All of Us database will allow us to examine the evolutionary merits or demerits of alleles that may have been adaptive in Africa, but may be less adaptive in an American context. So we are looking forward to this and hope very much that we can make a significant contribution to expanding the database, expanding our mindsets, increasing the utility of biomedical studies so they're more applicable to peoples of African descent and other peoples of color.
Thank you so much, Dr. Jackson. I was really intrigued by the focus of the research, in particular around chronic kidney disease, knowing so many individuals, in particular even young people, that are experiencing early signs of chronic kidney disease. And so I think this presents a real promising area of research that has real practical utility in our communities. And I think it's for that reason that it's HBCUs and similar institutions that really can connect the research to the community, right, in a different kind of way. So thank you for that. Again, we want to welcome all of you who have joined us in person, but also who have joined us online this afternoon for this event. At this time, I want to introduce Dr. Sula Hood, who is with RTI International, who will lead us into a conversation with our champion teams. Dr. Jackson has already kind of launched us and out the gate in that space, and so we want to recognize her. So, Dr. Hood, please.
Thank you, Al. I'm so very excited and honored to be a part of today's celebration. And so, before we get started and hear more from our institutional champions, I just want to start out with a brief background and overview of the Researcher Academy and why it's so important to just build on the information that Al and Dr. Jackson just provided. Next slide, please. So the All of Us research program, it is a historic effort to collect and study data from 1 million or more people across the US. And the All of Us program is very, very intentional about including people from a variety of different backgrounds that reflect the diversity of the US. And in particular, being inclusive of individuals and populations that are underrepresented in health research. The ultimate goal of All of Us is to speed up health research discoveries and enable new kinds of individualized healthcare. So our All of Us Researcher Academy specifically provides training and technical assistance for researchers that are utilizing the All of Us Researcher Workbench that houses the All of Us research data. And so the first phase of the All of Us Researcher Academy is directly supporting researchers at HBCUs. And so we're really excited today to honor and celebrate the first initial cohort of our institutional champions. Next slide. Okay, so as I mentioned, the purpose of the Researcher Academy is really to promote equitable access to and utilization of the researcher workbench that houses the All of Us data by a diverse array of researchers, including researchers at HBCUs. As you can see here to the right, we have a variety of objectives that are associated with our activities that I'll be talking about. We have internships and fellowships. We also have curated a very comprehensive training curriculum, as well as provide technical assistance. And partnership building is extremely important as we continue to develop and deliver the Academy components. Next slide, please. Okay, so I really want to just take a few moments to acknowledge our awesome internal team at RTI International. And I just want to back up here a second, as well as I'm looking at our team members, to introduce myself first and foremost. And so I'm Dr. Sula Hood, and I'm a senior research scientist at RTI International. And I also serve as a co-lead for the All of Us Researcher Academy alongside my colleague, Dr. Brian Southwell. We have our other team members that are always working, and a lot of our institutional champions, as well as our Academy scholars, get to work with our team members directly. We have Ms. Sherry Cates, Courtney Richardson, which is actually who is actually there with you all in person today. We've had Demarius Davis, Dr. Javon Carter, Ms. Tamara Terry, Mr. Trey Rashad Hawkins, who is a Howard alum. We have Ife Adewume, Heidi Geyer, as well as Ms. Brianna Walker. One thing that I'm really excited about with regards to our team, similar to CCPH, several of our team members are HBCU alums or have direct ties. And so, as I mentioned, we do have a Howard alum that is a part of our team. And then also, I want to make sure to acknowledge our PIs for our project, Doctors Megan Lewis and Jen Urick. Next slide, please. Okay, so as I mentioned, one core component of our Researcher Academy is to make sure that we provide training to our scholars. And so we do provide tuition-free course offerings and learning resources to individuals at institutions. These particular courses range all the way from how to access and the researcher workbench and analyze data within the researcher workbench, how to disseminate information through publications and other different outlets, how to secure funding. We also know that self-care for researchers themselves is very important. So we have courses on that. We also know that it's important for students as future researchers and scholars to be exposed to these types of databases and the data and the insights that are offered through the academy. And so we do also offer courses that provide guidance to educators about how to incorporate all of us into the classroom. And as much as possible, we've been very intentional even about making sure that our instructors are from institutions such as HBCUs. Next slide, please. Okay. So another core component of our Researcher Academy and the reason that we're here today is our Institutional Champion Award. And this award is very important. It provides a year of funding of up to $75,000 to support teams of researchers, including faculty members, students, and postdocs. As you'll see here later in a bit, our teams are interdisciplinary in nature. And so we provide funding to teams of health and social science researchers. Our initial cohort of our institutional champions were announced in August 2020. And I'm really excited for you all to hear about the great work that they're doing. And I do want to let all of our attendees today know that we have an active RFA open, and we're currently accepting applications for our second round of Institutional Champion Awards. Those awards are due March 13th. And so we encourage you all to please take a look, learn about the award, share it within your networks, and apply. You can access the RFA by visiting the link below, or we have included a QR code where you can scan here and directly access the RFA. Next slide, please. Okay, so students are also, as I mentioned, very important as we think about them as the recipients of education and future research leaders and scholars. And so it's very important for us to support students as a part of the academy. And one mechanism that we are including is our Researcher Academy internship component. And these are opportunities for students to have experiential learning through working with researchers that have active projects in the researcher workbench. These internships will be hosted virtually or in person. They'll be 3 months in length, and students will have the opportunity to present their work at an All of Us Research Program convention or another scientific convening. They are compensated for both the intern as well as the mentors. We are currently in the process of designing and finalizing our internship application materials. So please stay tuned for our next announcements that we'll be having that will be sent out later. So our internships will be starting in May of 2023, and we will be sending out information for the opportunity for students to apply. And students in particular that are eligible for this internship are graduate students as well as students that are advanced undergrads, including juniors and seniors. Next slide, please. Okay. And so finally, one aspect of our academy that I would like to highlight is our All of Us Researcher Academy newsletter. And this is really an intentional effort for us to really connect to the networks of individuals across the country at various different institutions and let everyone know about the great work that is being done through the Researcher Academy, as well as to extend opportunities to connect with the Researcher Academy. Our newsletter, which is called Connections, is published on a quarterly basis, and it features a researcher spotlight section where we highlight the research and accomplishments of our various different academy scholars. We also have a career corner section where people can get information and tips on career success. And finally, we also include announcements about the Academy, including upcoming classes and events for our Researcher Academy, as well as our various different partners. Our next issue will be coming out next month. However, if you are interested in reading our initial and current issue, please visit the link below or scan the QR code below. And at the last page of that newsletter, there is a link where you can sign up to be on the subscriber list for our next future issues. Thank you so much.
And thank you,
So
Dr.
now
Hood.
we're going to hear from our institutional champions. I'm really, really excited for you all to hear about the great work that they're doing. Thank you.
Thank you, Dr. Hood. I wanted to, as I was listening to your presentation, Dr. Hood, I was really thinking about the important role that all of us have in helping to disseminate information about these different funding opportunities. If you're listening and you're a student, there are opportunities for you. As a researcher, there are opportunities for you. And so I would love to hear from you regarding what are the ways in which we can work in partnership with you as students and academic partners to really disseminate information about these multiple funding opportunities. Dr. Jackson and I were having a conversation earlier about people being not being engaged, and then when opportunities come, they're either not aware or they're not taking advantage of it. And so I think that that's really important right now for us to think about how can we help to disseminate more broadly information about the All of Us network. You heard earlier from Dr. Jackson regarding her work as an institutional champion here at Howard University. We're excited that we have 3 other institutions that are joining us, and I will introduce them and then they will just take it away. And that is North Carolina Central University, Tuskegee University, and Southern University of New Orleans, and they will come in that order. Again, North Carolina Central University, Tuskegee University, and Southern University of New Orleans. NCCU, take it away.
Thais, you want to start?
Yeah. So good afternoon, everybody. It is a pleasure for us to be here as a awarded institution. First of all, I would like to introduce our team. So I am Dr. Thais Holanda. I have my PhD in pharmacology, and currently I work with cardiometabolic diseases, specifically with minority populations and health disparities. We also have in our team Dr. Doherty, who is a PhD in epidemiology, also a biostatistician, and has been working recently with COVID-19 health disparities and especially vaccine hesitancy. Dr. Alberico is a PhD in health behaviors and environment and works with us with geospatial data and social determinants of health. Dr. Leslie is also a member of the team, has a PhD in pharmacology, and works with cancer, more specifically prostate cancer and microRNAs. And we also have our brilliant students, Michael, Chima, and Samuel, who works with environmental health and geospatial sciences. Next slide, please. So currently, we are working on 2 projects. This first one, we are looking into PFAS contamination. And we know that in 1980, there was contamination in Cape Fear River in North Carolina, affecting thousands of North Carolinians. And this PFAS contamination affects drinking water and is associated to certain types of cancer, and also for increased risk for some metabolic diseases. Next slide, please. So we aim to use the All of Us data to see how this PFAS contamination has impacted people in North Carolina. We are going to use the available GIS data to map the areas downstream the Cape Fear River and determine health inequities and outcomes with this data provided. We will also determine if there are certain diseases associated to PFAS exposure, and if there is any association with long COVID symptoms and increased risk for adverse health outcomes. Next slide, please.
Okay, this is Irene, and I will take over this part, right, Tice?
Yes.
So, as everybody here knows, African Americans and Blacks distrust government, medical, and academic institutions such as ourselves. And so before the FDA approved vaccines, COVID-19 vaccine hesitancy, it was an issue, and it still is an issue. So with state funding, we established the Advanced Center for COVID-related Disparities, otherwise known as ACCORD, and we hosted testing events in 9 counties, and that was before testing was widely available. And we gave people a survey and assessed vaccine hesitancy. And we had about 1,300 participants of different races. So prevalence of hesitancy among all respondents, and Blacks in particular, was much higher than national representative surveys, although it decreased over time. So I already published this. And just to give you a sense, it was 75% of African Americans had reported vaccine hesitancy, as compared to 50% of African Americans in national representative surveys. So it's a disconnect. So next slide, please. Okay, so we did what you would consider a purposefully recruited sample, because we went into these poor neighborhoods. And what I want to do is compare the prevalence of vaccine hesitancy, and also accounting for time, because it changed, in different data sources, including the All of Us study. So we'll draw data from the COPE data set within All of Us and ask about vaccine hesitancy. And I was going to limit it to residents in North Carolina and just emulate the analysis I did for our study. So, however, the challenge right now is, even though that all of us is trying to recruit minorities, for my purposes, the current version only has 140 participants who identify as Black, and we had, I don't know, more than 600. So I'm not sure what I'm going to be able to do with that. I might extend it to South Carolina. I'm not sure. But that's where I'm going with this. That's it. Thank you. Next slide in university.
Good afternoon. This is Dr. Stephen Shodeker from Tuskegee University. I bring you greetings from Tuskegee. The first thing that I would like to do is to introduce to you my three researchers from Tuskegee University, and then the students that are working with us on this outstanding opportunity that we have to interact with the humongous database that the All of Us research program has made available to us. Dr. Chastity Bradford is a biomedical researcher. Dr. Diba Bedi is a biomedical researcher, and Dr. Shitra Nayak is a biophysics researcher. We have with us graduate students, Ms. Reshma Gurung, who is a PhD student, and Ahmed Omar, who is also a PhD student. Mr. Andrew Brown is a senior biology major, and Ms. Leah Holyfield is a senior biology major. Our major interests at Tuskegee is a mix of health disparities, health equity, bioinformatics, the impact of AI bias in increasing health disparities, and bioinformatics of that as well. We are carefully taking advantage of all of the courses that are being given in terms of trying to get access to the data that is there in the All of Us research database, researcher Workbench, and carefully working through the language of the subject, writing our first NIH grant. We are taking courses in mindful approaches to stress management, mindful and coping with microaggressions. All of these are ongoing, even as we are trying to figure out as well how to make All of Us research program popular within the various courses that we have. So within the introduction to research course at Tuskegee, Dr. Bradford is spearheading that. We are introducing the idea of the All of Us research programs by looking at some of the articles that have already come out reporting the capacity that the database does have and what one could do with it. We're interested in electronic health records, transcriptomic data for African Americans, and other available race data sets as well. So we have been busy, and we have been interacting and resolving the challenges that as they come with the help of the mentors that has been positioned by RTI to assist us. That's all I have for now. I'll give it to the next institution. Thank you.
I'm Dr. Derek Freeman, and I am the PI on the All of Us Research Academy with Southern University at New Orleans team. And I am an associate professor of social work and also a qualitative researcher at the university. Also, we have Dr. Mims Devazan, who is a biologist, a researcher of qualitative and quantitative research methods. We also have Dr. Morgan, who's part of our team. She is also a qualitative researcher, as well as an associate professor of social work in the School of Social Work at Southern University. And we have Dr. Centino, who's an assistant professor in the School of Social Work. And also she is a qualitative as well as a quantitative researcher. And also we have Dr. Thompson, who's associate professor in forensic science, and she's also a qualitative and quantitative researcher. The SUNO team started with 5 students, undergrad as well as graduate students, but unfortunately we had 2 students to drop out of our research academy team of champions. Today we have 1 undergrad, Ms. Amari UUT, who's a biology major, and we also have 2 graduate students who are part of our SUNO team. We have Ashley Shopswire, who is a graduate student in the Masters of Social Work program, and we have Deasia Martin, who's a graduate student in the School of Social Work at Southern University. The SUNO team is excited about this opportunity. Our research focus is to look at data center evaluation of Black and brown survivors of breast cancer and cardiovascular risk reduction. And when we talk about cardiovascular diseases, we're looking at disorders of the heart and blood vessels. And when we talk about cardiovascular disease and Black and brown communities and breast cancer, we want to look at various social determinants of health, which conditions in which people are born, grow, live, work, as well as age. As you know, these circumstances are pretty much shaped by distribution of money, power, and resources at the global, national, and local levels. We're not only going to want to look at social determinants of health, but we want to also address health disparities in our research, looking at, when we talk about health disparities, we're talking about the gaps in health outcomes or even the access to health amongst these Black and brown individuals or this population. And as we talk about health disparities, we want to look at health difference as it affects these disadvantaged populations. We also want to use the All of Us Research Academy's data as well as data that we will gather as a team to raise awareness about health disparities and improve health outcomes within the greater metropolitan area of New Orleans, or even statewide. Also, the team decided that we will look at health, population health, and the aim is to look at ways of preventing illness and improving the health and wellness or well-being of the local communities or where the School of Social Work as well as Southern University at New Orleans is located. In a metropolitan city as well as smaller communities around. So the SUNO team is excited We're working hard. We're not only working hard as professionals, but we're also mentoring three upcoming researchers. And the researchers have been the student researchers have been very involved in many of the research meetings as well as decisions that the team has made. That pretty much wraps up where the SUNO team is. If there's any member that wants to share any additional information, I welcome it.
Thank you, Dr. Freeman. And thank you to all of our presenters this afternoon for sharing. Again, I want to acknowledge the work that's being done at Howard University, North Carolina Central University, Tuskegee University, and Southern University of New Orleans. As we wrap up our presentations today, we want to encourage you to share any questions that you may have in the chat feature on Zoom. Feel free to weigh in on any questions, and we will actually have a session on Q&A in a few minutes. But prior to going to that, what we'd like to do is have a poll, and we want to get some information from you. So we're going to bring that poll up, and you will see that in your on Zoom, and we're waiting for that to come up. There's a game pin, and I believe you can use the QR code. I think people are registering. Caitlin and Raven and others are coming online. Leslie, thank you. Okay. What additional course offerings would you like to see added to the All of Us Researcher Academy? So we'd ask that you would please chat in, share any questions that you have. We encourage those of you who are in our virtual audience, but also those of you who are in person to actually participate in this. And we'll give you a few minutes, so please type your answer. These are open-ended questions. You've heard already what people are using, but we'd love to hear from you. So we'll give you less than a minute, so type fast. Okay, 15 seconds left. And our results will come up. Yes. We have 6 answers that were submitted, and I believe they will show in a few minutes. All right. So the responses are people, thank you for responding. The first answer or response is that people would like to see advanced grant writing. The second is in the area of statistics. Third, science and public policy. Spatial analysis of all data and an incoming response. GIS systems, mapping, research writing workshops, and a late-breaking contribution, and that is cultural competence. Thank you. So we appreciate that response. So again, we encourage you to chat in any questions. now we're asking you to respond to what other activities would you like to see developed through the All of Us Researcher Academy? You have about 10 seconds left. And we have 7 answers this time, and they're showing. They will appear. The first one is networking with other awarded institutions. Absolutely, I think that's one of the things I would offer. HBCU Theses Fair, where individuals can come together and share their master's, PhD as well. Community-based integration of research findings, community engagement workshops, inter-HBCU institutional collaboration programs. All committed HBCU champions join together for an annual gathering to network and meet in person, of course, here at Howard, I'm sure, and mentorship networking luncheons. Those can be in person as virtual and maybe even regional in some instances. Undergraduate mini project I think that means postal competition to encourage participation in research activities. Okay. Thank you. So maybe poster presentations. I think that's what that means. Yes. So thank you so very much for responding to that. Do we have another question, or is it our final question? No. Thanks for participating. And thank you both to our virtual audience and to our in-person audience today who joined us. At this time, I'd like to turn it over to Trey Rashid Hawkins. Trey, are you there?
Hey y'all, and good afternoon. My name is Trey Rashad Hawkins. As my colleague Sulahood mentioned earlier, I'm a proud HBCU graduate of Howard University, so it's an honor to take part in this groundbreaking initiative. I'm also an epidemiologist with RTI International and a research workbench coach with the All of Us Researcher Academy. Now, some of you may be asking yourselves, what exactly is the All of Us Researcher Workbench? Luckily, I'm here to break it down for you all and show you how to get started. Next slide, please. The Researcher Workbench is a cloud-based platform that houses all of us participant data. It is also the central location where registered researchers can access controlled and registered tier data. Its robust tools support data analysis as well as peer-to-peer collaboration within the platform. Additionally, there are integrated help and educational resources provided through the Workbench User Support Hub. Currently, the secure platform contains participant data in the control tier, including over 300,000 physical measurements and vital signs observations, over 370,000 survey responses regarding lifestyle, healthcare access and quality, over 132,000 survey responses regarding lived experiences with the COVID-19 pandemic, and 57,000 plus initial responses from our new social determinants of health survey. Additionally, there are over 250,000 electronic health records standardized by the Observational Medical Outcomes Partnership Common Data Model, over 12,000 wearable data observations from Fitbit devices, and over 100,000 observations of genome sequences and genotyping arrays. Next slide, please. To get started with the All of Us Researcher Workbench and register, which is the first step of joining the Researcher Academy, I will guide you all to the above link where you will follow these 6 following steps. The first step would be to access the data browser at researchallofus.org to gauge whether your data points are included within the data set to answer your specific research questions. Checking for your institutional's data use and registration agreement, or Juror, which I will talk about in more detail in the next slide. Creating a Researcher Workbench account, verifying your identity using login.gov, in which you would need a state registered ID, whether that be a driver's license, a non-driver's license permit, or just a regular state ID. Completing the All of Us research training via the Researcher Workbench would be step number 5. And lastly, you will sign the data use user code of conduct, also via the Researcher Workbench. And you can access all of these steps also using and scanning the QR code below. Next slide, please. The DIRA, or again, the Data Use and the Registration Agreement, allows researchers to access the All of Us Researcher Workbench with your institutional sign-off. Jurors provide access to US-based academic and health institutions, non-for-profit organizations, and governmental entities such as the National Institutes of Health. Thankfully, we're thankful to our partners at the Data Research Center at Vanderbilt University Medical Center for housing and administering our DIRA process. If you see that your DIRA, there is not a DIRA for your institution, there are also steps following step number 2 to apply for a DIRA for your respective institution. Next slide, please. Lastly, with signing up for the All of Us Researcher Workbench, if you are participating in this HBCU tour call, it is very important not only to use your institutional email address, but to also indicate that you are a part of the All of Us Researcher Institution with RTI International. And yes, we are very excited to have you all join us. Again, I'm Trey Hawkins, an epidemiologist with RTI International and a Researcher Workbench coach for the All of Us Researcher Academy. Thank you.
Before we end today, I just want to make everyone aware of some various different upcoming opportunities that we're really excited about to offer to everyone. And so I'll be sharing a few announcements. Next slide, please. Okay, so in February, we have, and we're currently accepting participants to attend, and that is a course sequence that is focused on analyzing data using R. The course will take place between February and March, starting on February 13th, ending on March 3rd. It is asynchronous. However, there will be 2 live virtual sessions, one in February and one in March. And that course will be co-taught by our instructor, Dr. Javon Carter, as well as another instructor in the UK, Dr. Emily Nordman. If you are interested in signing up for the upcoming R course, please visit the link below or scan the QR code to sign up. Next slide, please. We also have a few additional upcoming courses that I would like to highlight and invite interested individuals to sign up for. In January, later in the month, we have an advanced grants writing course for NIH applications, and that course is being led by our colleagues at Shaw University. And we also have an introduction on quantitative intersectionality research that will take place in March. And finally, an additional course that we have that is being led by our colleague, Dr. Vabren Watts, who is a Meharry Medical College graduate, is our being an effective peer reviewer. And that course will take place in April. If you have an interest in these courses, please sign up using the link or the QR code below here on the right of the screen. And once again, these courses, all four of the courses that I just discussed, are tuition free. Next slide. I mentioned earlier that all of us Researcher Academy internship will be spearheading May of this year, and students will be paired with mentors that are actively using the Researcher Workbench as a part of their data. And so we are currently seeking mentors. And so in particular, we're looking to identify mentors that have a doctoral level degree, have one or more active projects utilizing the Researcher Workbench, researchers that are experienced in mentoring and have a passion for training students to work with all of us, and have availability to start in May of 2023. As I previously mentioned, the internships will be 3 months in length, and mentors will be compensated with a $3,000 stipend and appreciation for their time and commitment in working with the students. And so if you fit those characteristics, or even within your networks, amongst your networks of colleagues, no colleagues who have a passion and potential availability to mentor and who are working with the Researcher Workbench, please share this opportunity. We have a mentor application that will be open until March 1st. And so you can scan this QR code to access the information about the mentor opportunity and to apply. Next slide. And we also have, as I mentioned, in addition to our institutional champion awardees that we've celebrated today, we are pleased to say that we will be funding a second round of institutions. And so the applications will be due on March 13th at noon. As I mentioned, the institutional awards will fund up to $75,000 to support researchers, including faculty members, postdoctoral fellows, and students as they work on a project utilizing the All of Us Researcher data. And so you can visit the QR code here to learn more and apply and access our RFA. Next slide. Thank you. And finally, I just wanted to make the announcement again about our Researcher Academy newsletter. Our next issue is coming up in February. However, you can freely access our existing initial issue of the newsletter, and by going to the link below or by scanning the QR code. So those are all of the announcements that I have As a co-lead for the Researcher Academy, I thank you for your participation and attendance today, and am eager to connect in your institutions and your faculty members and your students as a part of being a part of the Academy, whether it be through courses or through an institutional champion award or some other capacity. Thank you.
Thank you, Dr. Hood. We're going to close out at this time with some acknowledgments. I want to again acknowledge the RTI Researcher Academy team, as well as the team from Community Campus Partnerships for Health that have really worked tirelessly behind the scenes to make all of this happen today. Here's the photos of all of our team members. Virginia Hunter, who's a graduate of Central State University. Sarita Hannah Boykin, a graduate of Elizabeth City State University, and myself, a graduate of Livingstone. Again, thank you for joining us this afternoon in person and virtual. Have a wonderful afternoon. Thank you.